This is a series of conversations we've been having as the COVID-19 situation develops, especially in the developing world. I'm really excited to be joined by Jeremy Konyndyk today, who is with the Center for Global Development, has been a really outspoken analyst and leader on these issues. Jeremy, thanks for taking some time. You used to head up the US government's humanitarian aid organization, OFDA, at USAID, and you're an expert in pandemic preparedness and humanitarian aid. You've been around this space for a long time, and you've been really busy these days, commenting on, talking about, and even doing some real implementation work around this crisis. So great to get a little time with you. It looks like you've got a better setup than I do. I'm in my kitchen, and I guess this is your home, right, Jeremy?
This is my home in front of my very fancy IKEA bookshelf. Yes.
Nice. Well, thanks for taking some time at home to do this. We've got people joining us on LinkedIn as we're streaming this live. If folks who are joining have questions that they want to bring into this conversation, go ahead and leave them in the comments, and we'll try to get to whatever we can during the conversation. Jeremy, maybe just to start off, this is a fast evolving situation. I'd just love to get your overall take, particularly as it pertains to the developing world. Where do you think we are today on COVID-19? How do you see it going forward?
Well, I think we're seeing now, we can see what wealthy countries are able to do to begin to bring the spread under control. The countries that can afford to do large scale social distancing are doing that, and they're seeing, we're beginning to see some good effects from that. So it has brought cases down in China. It has kept cases from getting wildly out of control in South Korea, and South Korea now seems to be largely on top of their outbreak. And we're seeing in some of the parts of the US that began to implement some of those social distancing measures early, excuse me, we're now seeing curves hopefully start to bend and flatten, and maybe even bend downwards over the next couple of weeks. So, where countries can afford to social distance, meaning where their workers can afford to work from home, where they can pass the sort of economic packages that are necessary to do that, that we're seeing the curve start to modulate. I think the big worry now for the developing world is that for a lot of developing countries that may not be a viable option. Most workers in a lot of countries will work in the informal economy, not the formal economy, meaning they can't, they don't have an option to work from home. If they're not going and doing their work every day, they don't eat. And so, in much of the developing world, the tactics we're seeing elsewhere would translate to a choice between starving in the next few days or, facing the risk of this disease. So the path, I think the path forward for the developing world is still not as clear as in the developed world yet.
Yeah, and we obviously have a testing challenge here, even in the United States, a major one. We'll talk more about that too. But given the lack of testing all over the world, it's hard to know how big the challenge is at this stage.
Yeah.
Do you have a sense? There's been a lot of conversation about, well, developing world might be worse off in some sense. You use the word affordability, which is a good one. People just can't afford to social distance. Yeah. Some people have said, well, the weather is going to affect this, and so that's going to be better for a lot of developing countries in the global South. There was recent information maybe debunking that, at least in one study, one letter that came out. Yeah. There's been sense that, hey, there's people in developing world in general, the demographics are in their favor. People are younger than in for example, Northern Italy. Yeah. But of course, there's a lot of underlying health issues too. So I guess overall, as you read it, do you feel like we should be prepared for as big of a wave of this pandemic in the developing world as we've seen in places like Europe and the United States and China? I mean, is this just going to tear through basically every country in the world?
I mean, I think we have to be preparing for and planning against that kind of a scenario, and hoping it doesn't happen. But I think what we've seen so far is the countries that sort of hoped it wouldn't be as bad for them as it was in China, which is how I would characterize the U.S. and much of Western Europe, have found, actually, because they didn't prepare and act as decisively as China initially did, that they're facing outbreaks that are as bad or worse. So I don't think that repeating that mistake in the developing world would be a wise course. I think we need to, the world needs to be expecting it could be as bad as it has been everywhere else until proven otherwise. And there are some glimpses of what that might look like. There have been very frightening reports coming out of Guayaquil in Ecuador of a very bad outbreak there, and so we can't bank on hopes that the warm weather will take care of it. We can't bank on hopes that somehow a different kind of different demographic alignment in the developing world with younger populations will somehow result in an outbreak that's not as bad. There are a lot of variables here. We don't fully understand all of them because this is, of course, a new virus. And until we actually see how it behaves, I think we need to be prudent and cautious and put as many protections in place as we can.
I want to get into.
Let me just pause for a second because insofar as I'm in my basement, my son is playing with Legos directly above my head, and it is distracting me like crazy. So I just need to tell him to stop.
Go for it. Do what you got to do. And as you're doing that, Jeremy, I just want to say for those of you who are joining us, and I appreciate it. We've got people joining us from Uganda, from Saudi Arabia, from it looks like dozens of countries now. Thank you for joining us from all over the world. I've got young kids here at home, Jeremy, too, so I know that drill, and you may see them in a minute. But these are, as you were saying, these are kind of high-class problems, right? We get to work from home, and a lot of the countries we're talking about, working from home is simply not an option. So I wanted to get into what do you think governments ought to be doing before we talk about what aid agencies should do and the donors? What should governments do who are in low-resource countries? They have a high percentage of the population doing informal work. What should they actually do if social distancing is the tool, but it can't really work there?
I mean, I know this is something that the World Health Organization is grappling with right now, that a lot of developing countries are grappling with right now. I think for a start, anyone who can social distance should. And that's going to vary, it will vary, frankly, it varies even in this country who can afford to social distance. What we see we've seen in New York is that the worst of the outbreak has hit some of the outer boroughs where people are less able to afford to work from home or don't have that possibility. So I think for those who can afford to social distance, they should. I think in the developing world, some of the research on masks is not, it's kind of mixed, but it's being recommended here now by the CDC. I think wearing of masks in areas that are going to be high traffic, a lot of people, particularly indoors, will help to somewhat reduce the risk. How much that reduces, the science is a little unclear, but probably has some beneficial impact. And one thing that the developing world actually does quite well, and frankly better than much of the Western world at least, is large-scale public health measures. And so I think that scaling up contact tracing, scaling up supportive quarantine and isolation in a targeted way can also help. That obviously rests in part on testing, but one interesting aspect in the developing world is they've actually been doing large-scale PCR testing in many countries for years because of AIDS programs. Yep. AIDS programs in Southern Africa have invested in significant lab capacity in a lot of developing countries. So in some ways, they're a little further ahead in terms of being able to do high volume PCR than even parts of the United States. So there are some advantages in the developing world. I think we need to be building. Governments of those countries need to be building on and utilizing those advantages, and then the outside development actors need to be figuring out how do they plug into that in the best and most helpful way. So
let's stay on this theme for a second. You obviously worked inside the U.S. government doing humanitarian aid. A lot of the folks. It's kind of a similar cast of characters on the global conference circuit, working on a lot of these crises together, whether it's Ebola or long-term issues like HIV. How do you assess how the global community is doing on supporting developing countries and supporting the global South in this response? The World Bank has made some big announcements. USAID has appointed a key point person on this. When you look across the kind of constellation of international organizations that are supposed to be stepping up and it's their job to do this, how do you assess how we're doing?
Boy, I don't think we're doing great. I think that the UN system is trying to get on top of this, and they put out a $2 billion appeal from the big UN agencies. I know a lot of the NGOs and development agencies, development contractors, and so on are beginning to try and spin up some programs on this. They also face some big duty of care issues for some of their own staff. Yep. And that's that is a calling it a distraction sounds too trite, but it is a diversion from scaling the program.
It's a real thing, right? I'm hearing this from leaders of NGOs that they, of course, a lot of their time is spent on making sure their team is safe first. they have this huge responsibility for the countries and the populations that they serve. But yeah, they've got to make sure their team is safe.
I think that's right. And but so the usual suspects in terms of the UN agencies and the NGOs are trying to get on top of this. They're trying to make their own operational and staffing adjustments and and begin to scale up some new programs. I think where I've been really disappointed though is in the sort of country to country international leadership. We really in a way that's kind of similar to what we see domestically in the US, where there hasn't been clear federal leadership, and so each state has been pursuing its own policies, trying to procure its own PPE and do its own thing. We see a somewhat analogous situation on the international scene where there is not a single coherent leadership structure. There is not a coherent kind of vision or global strategy for what we're trying to do, and so each country is pursuing its own interests and pursuing its own. It's created this sort of competition, and that's really damaging, because what that means is that the big countries that are wealthy, or the countries that produce that had the ability to produce PPE and test supplies and so on prior to this, they can access, or they have the best shot at accessing what they need. But if you're a developing country, the ability to access the PPE you need to protect your health workers is close to zero, because you're going to get priced out by these bigger, richer countries that are, most prominently the United States, that are going around the world and trying to scoop up all the PPE they can get.
And of course, PPE is the personal protective equipment. You can envision the masks and the face shields and all that. And a key question, of course, is, what is even the appropriate PPE in a lot of these circumstances? Community health workers, as we reported, DevEx have been left out of a lot of the equations for getting any kind of PPE. And maybe they don't need the full kind of Ebola suit that we've seen in images, but they might need some basic PPE, and it seems likely that they do. So that does seem to be a big and open question right now.
PPE and testing supplies, basic medical supplies, all of these things are scarce right now for the developing world, because they can't afford to compete when all the rich countries in the world are also trying to buy them at the same time. And it's a real contrast to what we saw in Ebola. Now, Ebola was a different scale problem. It was a regional level problem, not a global level problem. But for that regional level problem, the world really did come together. President Obama convened a head of state level summit on Ebola at the UN General Assembly in September of 2014. He spent countless hours on the phone mobilizing other global leaders to get their countries into the mix, to provide support and also to unify around a common vision of what we needed to do. And the UN then could align with that. It's very difficult for the UN to lead a global effort when they don't have their most powerful member states pointing in the same direction. And so I think the fact that the US has been so inward looking on this so far, even to the point, and this has been reported now by a few outlets, even to the point of pulling back PPE supplies that were set aside for international use and trying to get those back and bring them back for domestic use. Well, it's very hard to mobilize a forward-looking, coherent global alliance to defeat this virus when the U.S. is behaving in that manner. And I think what we've seen as a former government official, it just devastates me to watch this. You've got the U.S. The image of the U.S. that the world is seeing right now is that the United States is going around competing with them. And so the countries that need PPE or need testing supplies are getting beaten out over and over again by a US government that can outbid them. And then on the other hand, when they look to China, they see a country that was able to get on top of its outbreak more quickly. And so now is shipping PPE all over the world. And while China is helping them, we're competing with them. And it's just a terrible situation.
Yeah, when you think about our international diplomacy from the U.S. perspective, the image of those ships getting turned around in the ocean to come back, boy, that's an iconic image that it's not going to go away for a long time. Right. We had a question come in about where is the leadership on the global front, and it's a good question, because a lot of people I'm talking to think there's quite a void, that we really don't have clear global leadership on this. I had Mark Dybel on this conversation just a few days ago. He was saying, why don't we get together all the people who worked on Ebola there's a lot of people around the world, people like yourself, who have this experience. Let's get a global task force together of Africans, of Europeans, of Americans, of others who've got the experience, and say, let's get some costed plans out there. He threw out a number. He was willing to just throw out the number of $30 billion, kind of a back of the envelope estimate.
Yeah.
But it does feel like we're looking at relatively small dollar amount commitments so far, relatively scattered approaches across the development landscape.
Yeah.
How do you see it? And what is that gap, to the question? What is the global leadership gap? How would you fill it if you could?
Well, I think filling the global leadership gap, it has to start with countries. You could put a team of those of us who worked on Ebola together, and I'm sure many of us would happily jump on that if we thought it had a chance to achieve something. I think that the difficulty is the big actions that need to be taken by governments and need to be supported by governments. And this is not something where global civil society can carry the burden on its own, and nor should it have to. You're not going to generate, and I don't know if 30 billion is the right figure, but it's probably the right ballpark. That's roughly what, for example, the humanitarian system seeks every year, or rather the humanitarian system spends every year. So that feels like probably the right order of magnitude.
Yep.
But that can only come from governments, unless you've got the world's billionaires that want to drop a good chunk of their fortune to make this happen. And maybe we may actually.
You'd hope they would. I mean, even there, you're not seeing that much action. I think in part it could be because of the lack of government leadership, right? If there were a clear cost and plan by the government, you might see more billionaires say, okay, that's something I can get into to fund, but they can't replace what government can do. They need to have a framework within which they can work, right?
Exactly. I mean, this is one of the things, when you work for the U.S. government, whether countries agree or disagree with the U.S. position, they have to react to it. Wherever the U.S. is on an issue helps to frame the debate, and so countries may disagree or agree with that. They may try to tweak it or change it, but it kind of creates a reference point for the global discussion on an issue, the global plan on an issue. And when the U.S. is absent, it's then hard to know what to coalesce around. And I think we're seeing that right now. We're seeing that dynamic in play.
We're just thinking about global leadership. One of the players that could be in that mix would be the WHO. Mm-hmm. And obviously WHO has been for many years, underfunded. There was a lot of controversy around their role in Ebola. But now that there's a different level of political controversy just in the last 24 hours or so with President Trump's kind of very direct attacks, and it's becoming a political football here in the US. I know we have people joining us from Ecuador and India and a whole bunch of countries, so they may not be as tuned into what's in the US scene here, but President Trump has really decided to go after Dr. Tedros, the leader of the WHO itself, kind of trying to pin the blame there. What's your read of that strategy, and what do you think the facts actually are? How should we all understand the situation?
Well, look, for whatever reason, President Trump and a number of other voices in the Republican Party, Senator Risch has said similar things. Senator Graham has said similar things. Many of the talking heads on Fox News are now saying similar things. For whatever reason, WHO, they've suddenly decided is the target. And I did a thread on Twitter on this yesterday where I said, look, you can look at this in three ways. You can look at, was WHO accurate in the information they provided? Were they timely in the information they provided? And did they sufficiently signal urgency? I think on the first two of those, they do pretty well. I think on the third, there was some room for improvement. But one of the things that the president and others have said is, complaining that WHO was too slow in confirming that there was human-to-human transmission. Well, look, the first reports from WHO at the beginning of January echoed what China said, which was that it was unclear whether there was human-to-human transmission. We now know that China was not being fully straightforward about that. But that was what WHO had to go with. That's what they were getting from a member state, and that's what they echoed. That was done by late January. On January 23rd, the WHO Emergency Committee, which is the committee that evaluates whether to declare a public health emergency of international concern, they put out a statement confirming the basic dynamics of this virus that remains pretty accurate today. They said it is a novel respiratory coronavirus. It transmits from human to human. It has a reproduction rate of somewhere between 1.4 and 2.5. That may be a little on the low end relative to what we know now, but it's it's in the ballpark. It's enough in the ballpark to be frightening. And they cited that it had a fatality rate, I think, in that document of about 4%, which again, is in the ballpark of where we've ended up. So those characteristics were accurate, and
that was January 23rd.
And that was January 23rd. So for as early as we were at that point in the world's knowledge of this virus, I mean, that was within 3 weeks of it being formally reported, or within around 3 weeks of it being formally reported to the World Health Organization.
And that was right around the time, I believe, President Trump was in Davos saying that we're out ahead of this and we're in good shape.
Right. That's right. So, to say, well, they didn't tell us about human-to-human transmission, well, that that gives you an excuse up to the 23rd of January. 2.5 months have passed since then. So it doesn't really, the accuracy of the information, I think, you can say at worst, they were a week or two late, but that was really not on WHO. That was more on what they could get from China. In terms of the timeliness, then, yeah, they put that out on the 23rd of January. They then, a week later, on the 30th of January, declared this a public health emergency of international concern. So there too, that that is the FAIC, as it's called, is the highest level of alert that the World Health Organization has, and that is under the international health regulations, which were written by the member states, including the United States. So, that is the tool that we gave to WHO as member states to say, this is the loudest alarm you have. Well, they rang the loudest alarm they had on the 30th of January. Again, more than 2 months ago. So I think on the timeliness as well, it doesn't really hold up. Then there's the question of the rhetoric they used and whether they could have signaled more urgency. And there, I think they could have. I think that, and again, hindsight is a bit 20/20 here, but it would have been good had they used a little more alarming rhetoric in the first half of February. Certainly by the second half of February, as the disease was clearly escaping China and starting to reproduce starting to transmit in South Korea, Iran, and then Italy, WHO began amplifying their rhetoric quite a lot. At the same moment, I would add that the U.S. government was still saying that the situation was under control and the risk to Americans was low. So, on any of those three criteria, I don't think it's fair to say that WHO was somehow the reason why the U.S. government didn't act. And it's also just a little bit absurd. We have the Center for Disease Control, which is a much larger, much better funded institution than the WHO is. Plus, we have the National Institutes of Health. Plus, we have a whole Health and Human Services Department. And since when does the U.S. government listen only to WHO when making such a momentous decision about a pandemic risk? It does not absolve anything. The U.S., whatever the WHO did or didn't do, does not absolve us from making our own analysis and making our own decisions. So I just don't think it holds up.
Yeah, it does feel like a pretty transparent political move, but I think there's an important implication to it. I want to get your take on this, which is, as we talk about where is the global leadership going to be for the response in the global South, WHO might be in that mix, but boy, when they become political football in the country that is their number one funder, it's hard to imagine that they can play that role of being kind of the tip of the spear for the emergency response in the global South. What's your feeling about that? Would you agree? And do we need to start looking at, maybe it's the World Bank, or maybe it's the UN, or maybe it's a global task force or some kind of new alliance that can stand up and make sure we have a costed plan, we have PPE, we have testing, we have everything we need to get the challenges in the developing world dealt with?
Yeah, WHO was never going to be the whole picture in support to the developing world. We always need an alliance of a lot of these different institutions, and look at how it worked with the Ebola outbreak in Congo over the last year and a half. WHO played a large role, but so did the World Bank, so did UNICEF, so did the World Food Program, so did NGOs like the International Rescue Committee and Oxfam and Save the Children, the Red Cross Red Crescent movement, and of course the government of the DRC. So nowhere is WHO going to be the only one carrying that burden. So I think that system can still work. And developing countries, have deep relationships with the WHO, they're still going to look to the WHO for technical leadership, no matter what President Trump may say about them. I think where the concern comes in is to defeat this international. Well, so to be safe at home, we need to defeat this not just at home but internationally. And to defeat this internationally, we need to be unified. We need to have a plan that is not pitting every country against each other and pitting global institutions against each other or against countries. The more divided and fractured we are, the more we work at cross purposes, and the worse this outbreak will be globally, and the less safe we all are. So I think it's just really short-sighted of the administration to be taking shots at WHO for what are basically domestic political reasons.
Yeah, I mean, if you think
trying to work towards a global plan on this that actually brings us out the other side safely.
Yeah, and just to go back to that first assumption you made, which is that if this spreads in other countries, it's a danger for countries that have already had it, like the U.S. or Europe. I mean, to me, that's pretty obvious, but that doesn't seem to be part of the mainstream narrative here in the United States. I'm in Washington, D.C. like you. The mainstream narrative here is it's all about us, get the situation here better. Yeah. But of course, you would think if the pandemic spreads wildly in other countries, it can come back here, and we can see multiple waves, as other experts I've talked to have said. And which means if we're not prepared for that, what we're going to be doing is setting up trade barriers and travel restrictions all over the world that could last for many, many months. And you talk about the U.S. can afford social distancing. Well, these countries that can't afford it also probably can't afford to see massive trade reductions. These are commodity exporting countries. They can't afford to see tourism drop dramatically. These are often countries that rely a lot on tourist revenue. And there's real potential for social dysfunction, for political dysfunction. So let's maybe shift the conversation a little to that broader humanitarian realm of what do you think is going to play out in the developing world if all of this does actually come to pass?
Yeah, I mean, I think the longer term vision here is it's a big concern. Right now, frankly, the U.S. is the epicenter, and we're the biggest threat to the world, which is an odd position to be. But we will, hopefully over the next 6 months, we will get this back under control in some form domestically, we will begin to turn aspects of our economy back on. It's going to be a large effort, and we could have a whole conversation around how off track we are in making that happen at the moment. But let's just, for the purposes of this, let's hope that happens. Then we need to be able to fully turn our economy back on here, and likewise for the European countries, they have to turn travel back on too. You can't have a functioning economy without trade, and you can't have a functioning trade system without travel. So we do need to have travel turned back on to some extent globally, and that is going to raise the risk of reintroduction. I think what we've seen over the last month with some of the Asian countries that were the first to get their transmission under control, that now the biggest risk they're facing is reintroduction of cases from travelers. And so I think we'll get to that point in the US and Europe over the next half of a year. And so, we do need to address this challenge in the developing world as well as the developed world, because we're not safe anywhere until we're safe everywhere. And then we need to keep it suppressed for probably a 2 to 3 year period until vaccines are globally available at scale. So do
you think for that period, 2 to 3 years, do you expect things like travel, global conferences, all of those things to really diminish over that longer period?
Yeah. I think until there is a vaccine, so until there is herd immunity one way or the other, and the way we want to get to herd immunity is by limiting spread until there is a vaccine. I think in the developing world that may be more difficult, and the developing world may achieve herd immunity more quickly because they may prove less able to stop the disease. I hope that that's not the case, but
and herd immunity, just to give people a sense, I believe it's between half and 2/3 of the population having the antibodies from this, and that's a pretty high percentage. I mean, so if you achieve that herd immunity through vaccine, thanks for that little trip you took us around your room, no problem, Jeremy. But if we achieve that through people getting the vaccine, that's one great way to get it. If you achieve it through everybody getting infected in a massive wave that overwhelms the health system, that's of course what we're all here trying to avoid.
Exactly. No, that's exactly it. Herd immunity through anything but a vaccine is just an absolutely devastating event. or getting the process of getting there will be absolutely devastating, and it will devastate health systems. It will devastate communities, and so we do want to avoid that. But of course, if you successfully avoid that, that means you have a large remaining population of susceptible people who still could get the virus, and so you need to be very vigilant. We need to be very vigilant at a global level then over that 2 to 3 year period until we can achieve herd immunity through vaccines.
What are you hearing? What are you hearing among your humanitarian aid colleagues, right? Because before this whole thing happened, the humanitarian system was stretched incredibly thin,
yes,
with growing climate-related droughts and migration and refugees at historic levels, and a lot of political dysfunction, rising authoritarianism. I mean, the list goes on, right?
Yeah.
So now you add this layer of a global pandemic on top of it. A lot of the countries we're talking about that already had ethnic conflicts and other challenges are going to have dramatic economic losses, maybe more hunger, maybe trade restrictions, et cetera. How do you see this playing out, and what are humanitarians doing to try to get ahead of this, or get ready, or be prepared in any way for what could come?
So I think it's a real structural challenge to the humanitarian system because our normal way of operating won't work here. I wrote a piece about this, a blog post about this for the CGD blog earlier this week, along with my colleague Patrick Saez. The normal way that the humanitarian system operates is if there is a crisis somewhere, that crisis is usually limited to one country or some regional subset of countries, and we deploy a lot of capacity there. We send emergency surge teams, and we send a lot of money. And that depends on the ability to actually surge to a defined location. And of course, it depends on the ability to travel. And neither of those things are things we can really do right now. So I think the normal way that the humanitarian community would react to a new emerging crisis is simply impossible here. And that means we have to try something different. We need to, I think that what that's going to look like is we need to be much more working in support of, rather than in parallel to, national governments and local partner organizations. The humanitarian community has talked for many years about localization and local ownership and but frankly, it has not delivered on that in its business model. And I think now we have to, because we cannot use our normal business model and hope to succeed here or hope to be relevant here. We will be stretched too thin, and the tools that we are used to using won't work. And so we do need a new model. And this is one of the things that disappointed me about the UN humanitarian appeal that came out a couple weeks ago. It was a $2 billion appeal, but it sought 95% of that money for the UN organizations themselves. It was not a global humanitarian appeal in the sense of trying to reflect and address all humanitarian need. It was really just the funds that the UN agencies needed for their own operations, plus a little bit here and there for a few NGOs. That's not going to work. That's not going to cut it. And it worried me that in what the UN was signaling with how they structured the funding request there was really a doubling down on the traditional model rather than a serious attempt to grapple with the limitations of how that model would apply in this crisis.
Yeah, and it makes me think, we've written about and talked about, and you've been a big proponent of the move to humanitarian cash transfers, right, as the general term, this idea that instead of going in with food and supplies, in some cases, you can just directly transfer money to people, mobile money or electronic wallets, debit cards, et cetera. Yeah. But still, most of that conversation historically has been about the UN agencies or the big NGOs essentially taking the model they already have and just starting to do more humanitarian cash transfers. Yeah. In a crisis like this, it seems like you could start to envision other institutions like the World Bank or the IMF or government agencies doing a bit of what the US government's trying to do right now with this paycheck protection plan here in the US to get money right out to Americans who need it desperately. You could start to imagine that system of cash transfers happening in many countries in the global South, and through different institutions, that aren't necessarily typically part of the humanitarian space. So I wonder how you see that potentially developing, particularly this cash transfers opportunity in front of us.
Yeah, it's a really important point because, of course, the U.S. is not the only country that needs to give economic support in order to enable social distancing, and the U.S. is not the only place whose economy is going to be really badly affected by this. This has the potential, depending on how we see the global economic impact roll out, this has the potential to roll back years and years of development progress. And so providing that some kind of economic support to the most vulnerable in the hardest hit countries, and economic support to people who cannot otherwise afford to social distance, is an important tool, not just for mitigating the economic consequences, but also for trying to limit the spread of the disease. The challenge is how do you do that in an organized way on a global scale? I think it's very, very difficult. Some countries have a social safety net architecture in place that perhaps the World Bank could piggyback on to provide some of that kind of support. But a lot of the workforce in much of the developing world is in the informal economy. They may not be they may not be part of a social safety net like a social security system or something like that. And so there's one challenge here, which is how do you generate the money? That alone will be a big challenge, but
it's a big one.
That's a big one. But at least the World Bank, does have resources available, and they could go back to their member states for authorization to perhaps realign priorities and free up more resources. But even if you can solve that problem, you still have to then figure out how do you target and distribute. And some countries have an architecture for that, but many don't. And I think it gets to why one of the development priorities for the world going forward needs to be investing more in national safety net programs and cash distribution options through those programs, both because they're a good thing to have under any circumstances, but particularly because in an event like this, you need to have them.
Yeah, it's a great point. It seems to me, looking ahead, there's probably two pillars of development that have been around, but are going to become much more important. And that's the primary health system, where we're going to start to say, boy, this is a minimum. Every country needs a strong primary health system, because if they don't, the whole world's at risk. We're only as strong as that weakest primary health system. And then the other is the ability to quickly get money out to people when they need it. It is a lot of money in a sense, just like in the US, the trillions of dollars sound like a lot of money, but part of the economic argument is it's a lot less than what it's going to cost you to deal with this problem if you don't do it, because the long-term costs are so much higher.
Absolutely.
And I'm not sure that narrative is out yet when it comes to global development, right? I don't hear our community talking in the big numbers that probably we should be talking in. I still hear us kind of having what Paul Farmer often talks about as that scarcity mentality.
Absolutely.
We have to just ask for as much as we might be able to get, as opposed to talking in the big numbers we should. What do you think?
No, I think that's absolutely right. I think one of the big takeaways from this whole experience, when and if we come out the other end of it, is we need a worldwide Marshall Plan for public health. We see here how economically devastating it is when we underinvest chronically in public health. And I think what looking at this just from the U.S. perspective, after 9/11. We recognized that we did not have nearly as robust a counterterrorism architecture as we needed in place, and we began pumping between 150 and 250 billion dollars a year into U.S. counterterrorism efforts for the subsequent several decades, and that's still where we are today. Because we as a country felt like that was a worthwhile investment after we had lost 3,000 lives and had a national crisis on 9/11. Well, we are well past that death toll on this. We are facing much worse economic damage from this, and it's a much more enduring, it's setting up to be a much more enduring challenge and crisis than any terrorist event has yet ever been. So I think we need to invest in protections against this with the same seriousness and the same kind of resource envelopes that we're talking about there. Now, I don't know that we need $250 billion a year, but we do need a mentality that looks kind of like our counterterrorism mentality. When we provide, CT support or intelligence cooperation, these aren't always comfortable things for development and humanitarian folks to talk about. But when the U.S. government provides that kind of support to a foreign government, the U.S. is not doing that for the good of that foreign government solely. They're doing that because there's a recognition that protects American safety. And I think we need to take the same mentality here. When we invest in health security and outbreak preparedness and early detection and surveillance in a developing country. That protects us here, because these diseases can come from anywhere and they can spread anywhere. And when we have vulnerabilities to spread anywhere in the world, we are vulnerable here in the United States, and we need to start thinking about this challenge that way and investing in it with that degree of seriousness.
Well, what's crazy about it is that that's not a new argument, right? I mean, we had a
No.
report in 2017 we put out at DevX. We interviewed 40 global health leaders, including Dr. Tony Fauci, and said, hey, what are your big concerns on global health security? Number one concern was a flu-like influenza pandemic. Everybody knew this thing, and yet we were behind the 8 ball on it. Now you would think, given this, we would know. I want to ask you in particular, because I can imagine somebody like Dr. Debbie Birx, who I've interviewed before, obviously we've covered her a lot at DevX, this would resonate a lot with her. I mean, she leads one of the world's largest global health programs. So how do you assess how she's doing? And do you think she's going to be in that position to really push forward a bigger global health plan, given where she is situated now in the White House?
You know, I don't know if the Trump administration will go for major worldwide investments in public health. I think their track record so far has been to try and pull back U.S. investments overseas, and they have, you know, in every budget cycle, they have tried to reduce funding for global public health and health security programs. You know, hopefully they're learning their lesson, but I'm not going to give them credit for learning it until we actually see them do that. So, you know, whether it is, you know, emanating from the Trump administration or maybe something that's more like a global G7 or G20 push, we do need this kind of an approach at a global level. We need to really triple down on investments in global health security. You know, as for Dr. Birx, I think, look, she is obviously a hugely capable, highly respected expert, and I think she is in an impossible situation. She has to make decisions and trade-offs every day that are you know, that are impossible and that no human should have to make, and she is trying to do what she can, I'm sure, within a wider administration structure that is highly dysfunctional and can be upended at a moment's notice depending on what the president sees on Fox News. So I think she's in a very, very tough spot.
Yeah, I think that's certainly true. We got a question that came in. In fact, we had a few questions came in. I think you've addressed a lot of them just through the course of our conversation, but one just following up on our conversation about primary health. I mean, the question is basically, if we did invest a lot in primary health, would that really help us to mitigate a situation like a global pandemic like this? I mean, are those two things really that connected? Maybe you can explain that a bit to the questioner.
Yeah, definitely. No, they are connected. I would say not just primary health, but public health. You know, what we have seen is that the countries that have performed the best so far, and that would be, you know, that would most notably be South Korea and Singapore. But I think you can put the territories of Hong Kong and Taiwan in a, you know, in a similar category here, because they've adopted a similar approach and seen similar results. You know, it is the countries that have gone big early on public health measures, that rolled out testing at a large scale, tied that testing to robust contact tracing and then robust quarantining of contacts and isolation of known cases. You know, that is just classic bread and butter public health. But it takes technology. South Korea and China, and I believe Singapore as well, have all used big data technologies to support that contact tracing effort and the notification of people when they may have been exposed. And it just takes a lot of bodies. It takes a lot of people. There was one report in the New York Times that at the peak of the outbreak in the city of Wuhan, there were 18,000 people for a city of about 11 million, 18,000 people working on contact tracing and related activities. You know, we don't have anything like that kind of an infrastructure in the United States, and we need it, and we need it here, and we need it abroad. And if you have that kind of, you know, ability to scale that bread and butter public health intervention, that is a powerful, powerful tool, both for bringing the numbers back down, but then also for keeping them down. And this is one of my big concerns right now is you see some states beginning to do that. The state of Massachusetts is working with Partners in Health, which, you know, it's an organization many of us know well, is working with Partners in Health to recruit 1,000 contact tracers for the state of Massachusetts. That is a great start. Every state in the country should be doing something like that. Every country in the world should be doing something like that. But it takes a plan, it takes money. And that takes a strategy and a level of investment that so far I think have been lacking. So yeah, those investments are directly germane, and they are directly germane both to how we get out of this one safely and how we can most rapidly get to a point where we can turn our economy back on. But in the long term too, there's huge positive externalities to that. If we have a more robust public health infrastructure in the US and in the world, that's good for a lot of things beyond COVID.
Yeah, absolutely. On many of the other issues that countries are grappling with. Let me ask you quickly in our remaining time, we have a piece out today about Mark Green. Let's see, is it today that it's tomorrow, is his last day as USAID administrator. He's retiring, moving on. How do you assess how he's done? I mean, it seems in some ways a strange moment. We have another visitor here. A strange moment to be retiring from that role. How do you assess that? What's your view as someone who used to work in that institution?
Yeah. I thought my dog might make an appearance, but he hasn't so far. I think Mark Green has done a good job under the circumstances. You have to compare what's happened to USAID to what's happened to other major institutions. So look at the EPA, look at the State Department, look at what's happening to CDC right now. There has been a real pattern in this administration of institutions getting on the wrong side of the White House and then being undermined from within by the leadership the White House puts there or through just neglect. And I think to his considerable credit, Mark Green has managed to navigate over the last three or so years he's been in that role. He's been able to navigate USAID on a path that has avoided that kind of an outcome. And I think he's done some good things at the same time. So he has avoided getting USAID under the sort of laser that some of the other agencies have faced, and he has carved out space for himself to do some useful things. I mean, I think his journey to self-reliance, reorganization has a lot of good ideas in it. I think the framing of a journey to self-reliance is it's a great way to describe what it is USAID tries to do. Is the substance dramatically different than what USAID had done before? Not dramatically different, but it's a good way of kind of describing and articulating the importance of USAID's mission to a Republican audience. And I think he's done a really effective job of that. And then, some of the things he's done while he's there, I think the internal reorganization that he has gotten underway are really important. I was really pleased to see him move forward with the creation of a Bureau for Humanitarian Affairs, which was something that we had proposed at the end of the last administration, the merging of my old office, OFDA, along with the Office of Food for Peace, and elevating those into a standing humanitarian bureau. And to his credit, when he and his team came in, they took that and they ran with the ball, and they're making it happen. And so, yeah, I think it's certainly not a perfect tenure, and I've disagreed with him and with with the administration's policies on a number of different things, including some of the way they've handled support to religious minority groups in Iraq. Obviously, I think they've been a disaster on sexual and reproductive health. But again, compared to the benchmark of how a lot of the other institutions of our government have eroded during this time, I think he is leaving in place a much healthier USAID than we'll be able to say of the State Department or the EPA or any number of other places.
Well, it's a pretty critical moment to have a leadership shift like that. An agency like USAID is going to be right at the center of this response, something we're going to be very focused on. Yeah.
Hopefully they will be. But yeah, I mean, they're not on the task force. They're not, they're kind of flying under the radar within the U.S. administration's work on this, which I think is unfortunate. But.
Yeah, it's a really big question, given that there's the response itself and there's all the secondary effects. And as you say, it's going to affect development a lot. I mean, USAID is going to have to dramatically pivot, as are all the major development agencies in the wake of this. So it's a story we're going to be on. We've got a piece out today, a really interesting analysis of his legacy, really, as a USAID administrator. But also, we're very much focused on covering how the agency is going to shift over time. Listen, we're kind of running out of time. I really appreciate all the people who've joined us, but maybe just give you a chance to give us a last take, because one of the things you've been really outspoken on is really the U.S. domestic response on this, and how much, in your view, that seems to be really failing. So maybe you can just take us through how you think that's going, where you think it's going to going to go, given we are the epicenter, it is going to have a lot of influence on how the rest of the world is able to respond to this.
So we got about another hour to cover that, do we?
Well, it's probably easy enough if I just tell you to give us a grade, because I have a feeling I know what that grade will be.
I would probably at this point, I would grade us at a D. You know, the D verging on F. And that sounds really harsh. And you know, what you sometimes, the pushback you sometimes get is, well, but everyone's working really hard, and everyone is working really hard. And so, you know, even when I'm critical of the administration, I think it is really important to recognize that, you know, the men and women at the CDC and HHS and the State Department and USAID and all the different parts of the government that are working on this, they are working hard. They are putting in a lot of effort, but they are not being supported by a leadership structure that is effective and that is proactive. And, you know, I think the fundamental flaw, the fundamental flaws in the US response boil down to a few things. One, at the very outset, was simply a failure to ask a few very basic questions. You know, on January 23, when WHO confirmed that there was human-to-human transmission, and on that same date, I believe it was, that the Wuhan lockdown began, and China then began rolling these dramatic lockdowns across in much of their country. The obvious question to ask at that point was, could that happen here? Could, you know, what we know of this virus, could it do the same thing if it got to the United States? And the only honest possible answer to that was yes. There was no reason to think, you know, there's no reason to think that a virus that does one thing in China will do a very different thing everywhere else. So, you know, that question then should have prompted the second question, which is that if it would do the same thing here, are we ready to protect against that? And the very obvious answer to that was no. And you know, that was confirmed obviously through a lot of the work that we had done in the Obama administration, analyzing that and beginning to put more pieces in place for that. But it had been reconfirmed by some of the work done during the Trump administration, including the Crimson Contagion tabletop exercise that HHS had done in 2019. You know, so you know, those two questions were obvious. The answers to those two questions were obvious, and then the next step should have been obvious, which is that we needed a full court press to prepare the homeland for the arrival of this virus, and that would mean scaling up testing and diagnostics. That would mean shoring up our PPE supply chains. That would mean readying our hospitals for surges in cases. That would mean setting up surveillance so that we would know when it was beginning to spike. That would mean pre-planning for the kind of social distancing and shelter-in-place measures that we're currently seeing. And you know, all of those elements had been, all those many others had been listed in a playbook that we had put together at the end of the Obama administration. So I think it started with the failure to ask those questions. The next failure then was a failure to be proactive rather than reactive or inactive. And you know, I think the overall US response when it came to domestic preparedness was really inactive, virtually inactive through the month of February. The focus during that entire month, which we now know was the critical missed window, the focus during that month was on the threat from overseas. It was not on preparing for the arrival of that threat here. So we didn't go from inactive to reactive until, you know, the first half of March. And it was only about midway through March that we really shifted to a fully reactive mode and began taking the, you know, scrambling then, because we were so far behind, began scrambling to shore up PPE, surge support to hospitals, try and ramp up testing. And even that is still not good enough, because the only way you beat a virus like this is by being proactive. You know, we know that the virus is constantly running ahead of us. We know that there is, you know, because of the lag time between exposure and developing a severe illness, that can be 2 to 2.5 weeks, and it can be another 2 to 3 weeks from that point to when someone either is discharged from hospital or dies. So, you know, if you're going by the case numbers we're seeing, then, you know, what you're reacting to is actually you're reacting to where the virus was 2.5 weeks ago. If you go by death, you're reacting to where the virus was a month ago. And, you know, most of what the US government is still doing is that it's reacting to what they see in front of them rather than being proactive, laying out a plan and trying to get ahead of this. And we're ultimately not going to succeed until we can be working towards where we want to be 2 months from now, rather than reacting to, in reality, where the virus was 2 to 4 weeks ago.
Yeah, exactly. And so, sure, you can continue to see what we're hearing now as kind of positive trends in a sense,
Yeah,
with a very severe, social distancing, stay at home, lockdown kind of scenario. But if you want to get out of that, you got to move to exactly what you described, which is ubiquitous testing,
yeah,
contact tracing. You got to be out ahead. Otherwise,
yeah.
it's hard to reopen the society and the economy. So this is a big moment, and really appreciate you taking time to help us think through what's going on. People are used to seeing your name in the pages of DevEx. It's good to get a chance to actually chat like this.
My pleasure.
Jeremy Konyndyk, who's with the Center for Global Development. Thanks so much, and let's stay in close touch. And thanks to everybody who's been part of this conversation today.
Thanks, my pleasure.